Good morning, ladies and gentlemen. My name is Leena Ramrattan. I'm a researcher at the HU Center for Health Economics, and my presentation is entitled Measuring the Economic Impact of Chikungunya in the Caribbean. My presentation will take the following format. Firstly, the four categories of chikungunya costs, namely government or public health costs, individual or household costs, business costs, and national development or macroeconomic costs, along with relevant case studies, will be outlined. Secondly, the primary results of a cost of illness study that was undertaken in Reunion Island will be presented, and finally, concluding comments will be made. From our research at the HU, we have not come across any study on the economic cost of chikungunya in the Caribbean region. However, we have been tracking this using the limited data that is in fact available. My presentation will therefore highlight the information that should be used to derive the cost and economic impact of chikungunya in the region. As previously mentioned, there are four categories of chikungunya costs that we should take into consideration. The first two cost items constitute a cost of illness type study, while the second two lead us into a broader economic impact type assessment. Firstly, government or public health costs relate to what the government is doing or is required to do in terms of disease prevention, treatment, and mitigation measures. These include additional costs. In other words, costs that are incurred over and above the norm at the national or community level for health education messages, as well as equipment, materials, and personnel for spraying and fogging activities, public health inspections, and screening at ports of entry. Additional costs are also incurred in the actual treatment of cases at public health institutions and include the cost of supplies, lab tests, hospitalization, and rehabilitation, among others. In the case of Jamaica, the Ministry of Health reportedly allocated an additional 362 million Jamaican dollars, which is equivalent to US 3.62 million, to control and mitigation efforts in the second half of 2014. To the second cost category, individual or household costs refer to what sickened individuals or their relatives are paying, primarily to private doctors and medical centers, to diagnose, treat, monitor, and manage their condition. Direct costs include the immediate and ongoing costs of consultation, medications, and physiotherapy, etc. Indirect costs include the costs of travel for treatment, non-medical items bought to assist in managing the condition, such as insect repellents, and other mosquito control supplies. While most of these costs are relatively easy to obtain and calculate, there is definitely more difficulty in measuring the intangible cost. In other words, the immediate and longer-term pain, cost of pain, suffering, depression, social dislocation, and loss of quality of life of chikungunya patients. This table, compiled by Vanessa Baksh, the editor of the UE Today campus newspaper, presents a snapshot of some of the basic costs that a chikungunya-afflicted individual is likely to encounter. It should be noted that the total cost to the chikungunya patient would depend upon the duration of his or her symptoms, and ongoing symptoms can result in prolonged pharmaceutical use, as well as an increased frequency of doctor's visits and possibly repeated blood tests for virus confirmation. Private costs can escalate quite quickly given the chronic nature of the chikungunya virus. On this slide, I attempt to put forward a rough estimate of the total cost of chikungunya to individuals in Trinidad and Tobago. It should be noted that the following assumptions were made. All initial visits were to private general practitioners, and the chikungunya prevalence rate was conservatively estimated at 10%. In comparison, using CARPHA's data on reported cases in Guadeloupe and Martinique, which are both French overseas territories where more rigorous data tracking and collection techniques are in place, we estimated prevalence rates to be as high as 20%. The average initial cost, including a consultation with a GP, a blood test, and a 2-week prescription for Panadine painkillers, amounted to TT 650. Assuming a 10% chikungunya prevalence, we have 130,000 affected persons. Therefore, the total cost to individuals is estimated to be TT 84.5 million, or US 13.2 million. This is partially covered by insurance, but the brunt of the burden is definitely borne by individuals out of pocket. The third category of costs, business costs, can take on 3 primary forms: absenteeism costs, presenteeism costs, and additional business costs. Absenteeism costs essentially refer to the production losses, both of goods and services, incurred by businesses as a result of absent workers who are ill with chikungunya, or who are relatives of persons who are ill and are forced to stay away from work to provide care to these persons. Production losses can also result when persons who are ill are present but unable to function at full capacity. This is known as presenteeism. This can result in the reduced availability, timeliness, and quality of services. Business costs also include increases in health insurance premiums resulting from more medical claims. This is a more long-term type impact. In the case of Jamaica, a sample survey of 101 member companies undertaken by the Jamaica Manufacturers Association found that 81% of companies reported having workers affected by chikungunya. Affected workers stayed away from work for an average of 4 days, and at 8 hours per workday, a total of 35,072 man-hours were estimated to be lost as a result of absenteeism. In a separate estimate, the CEO of the private sector organization of Jamaica, Dennis Chung, stated that more than 13 million man-hours were estimated to be lost due to chikungunya-related absenteeism. This resulted in approximately 6 billion Jamaican dollars, equivalent to US 60 million, in financial losses since the epidemic began. Finally, national development or macroeconomic costs refer to the lost or deferred expected benefits as a result of current programs and projects having to be curtailed because chikungunya has become the new priority. In other words, what are the opportunity costs or benefits foregone because of the negative impact of chikungunya in terms of the shifting of resources from other development and social pursuits in order to combat the disease? These include economic losses, such as the cancellation or reduction in tourism visits. For example, travel advisories were issued on chikungunya in the Caribbean by the Public Health Agency of Canada and the CDC in the United States in August and November of 2014, respectively. Cancellation of social events, such as entertainment and sporting activities, and education losses for sick school children are also examples of economic losses. The following table presents the primary findings of a cost of illness study that was conducted to assess the impact of chikungunya on Reunion Island's health costs during its 2005-06 epidemic. A bit of country background on Reunion Island. It is a French overseas territory that is located in the Indian Ocean, and its characteristics are very similar to those of the Caribbean islands. It has a tropical climate, its population and geographic land areas are quite similar, and it is also prone to natural disasters. Furthermore, its economy is becoming increasingly tourism-based. From the table, you will observe that the combined costs of consultations, drugs, and serological tests, which are primarily paid for by individuals out of pocket, amount to a notable 41% of total costs, almost equivalent to that of indirect costs at 40%. It should be noted that intangible costs, or the non-financial costs, such as the impact of the disease on the patient's quality of life, and non-medical direct costs, such as transport costs, were not included in this study. While there is certainly value and merit to conducting a cost of illness study similar to that of Reunion Island in the Caribbean region, from a broader health economics perspective, a cost-benefit analysis is what is really required. In conclusion, I'd just like to stress the importance of the following points. The gaps in the management of the vector have resulted in repeated dengue infections in the Caribbean region over the years and have now led to the rapid spread of chikungunya in the region within the last year. Now, you may have been wondering why I put up a picture of the Aedes aegypti mosquito early on in the presentation. This really is to emphasize the point that the mosquito is the root of the problem. In essence, we need to think beyond chikungunya, both as an acute as well as a chronic disease, since the positive externalities, such as a healthier environment and improvements in training and awareness, are quite high, and the economic gains, averted costs, and savings to be derived from integrated vector control, surveillance, prevention, and management extend far beyond chikungunya to other mosquito-related diseases, such as dengue, yellow fever, and malaria. From the available evidence, it appears as if individuals, and by extension businesses, are bearing the brunt of the cost of chikungunya in the Caribbean. Finally, there is a dire need for accurate, comprehensive, and routine, as opposed to responsive data collection, to allow for timely and rigorous cost-benefit analyses, as well as other types of studies to be conducted in the region. I now leave you to ponder on these vital issues. Thank you very much for your attention.